Hi guys, welcome back to the channel. Today I'm going to be talking about the most dangerous treatment you can get. Ooh. So in previous episodes, like way back because of the way that we film things, I told you guys that I was going to be having some surgery done. And I did have that surgery done. In fact, I went and got myself a BBL. A few months ago, I went to go and see Dr Aslani, who was recommended to me by a colleague of mine to get my BBL done. Now, I have never really had much of an ass. I go to the gym, I work out, I do the squats, I do the deadlifts, I've got a personal trainer, and of course all that stuff really helped, but genetically I'm just like not that shape at all. I'm not supposed to be that shape. And you know my philosophy about these things, which is if something bothers you and you can change it, then why not just go ahead and change it? So I did. So I'd previously had liposuction done a few years ago. It must be, I don't know, maybe like 4 or 5 years ago now. And at that time I had it done in the UK, and I had abdomen, a little bit of flanks, a little bit of inner thighs, and I did have some fat transfer. But it was only 300 mils per side to the butt, because at that time it wasn't really a super popular thing to do here. And in a way, I kind of wish that I'd saved that fat for later, but it wasn't really a procedure which was done here at the time. So I didn't, and most of it, I imagine, got chucked in the bin. To anybody that's considering having liposuction, I would say maybe try and do something with that fat. You know, you could put it in your face, you can put it in the breast, you can put it in your bum, you can extract the stem cells from it and then just use that for skin rejuvenation. It just kind of seems like a shame not to use it somewhere. So anyway, I went over to go and see Dr Aslani, who's based in Marbella in Spain, and it was quite a ride. It was quite a ride. I'm really super thrilled with my results. But something that I always say to my patients is the course of surgery and non-surgical procedures never runs smooth. So while I was over there, I created a video diary for you guys to watch just to see exactly what I went through when I had the procedure. So, you know, you go over, you go into the hospital. So they have their own surgical facility there. You get the procedure done, you stay in one night overnight, and then you have to stay in the area for 2 weeks. Like, you can't fly for 2 weeks afterwards because you can't sit down. In fact, you can't really do anything for 2 weeks apart from just kind of lay on your front like a worm and stand up, and they're your two positions for 2 weeks. I was really hoping to get some work done, but my God, you're just like totally knocked out after surgery. There's just no way that I could do anything. So I was just basically watching Netflix for 2 weeks. You're really super swollen after you have the surgery. So when I woke up, like the amount of fluid and swelling that you have in the body is just insane. You kind of look like you've been in a car accident, no joke, because you're like black and blue from here all the way down. And what someone didn't tell me was exactly how much swelling you would get down there. That was a shock to me. I think if you are going to have surgery like this done, it definitely makes sense to stay somewhere where you are going to be looked after afterwards. So I stayed in the townhouse in Marbella, and it's run by a lovely lady called Joanna, and she basically caters to your every need for the following 2 weeks after you had the surgery done. So, you know, she changes your bedding, does your laundry, all that stuff, makes your food, and the food is like super good. It's just a really nice environment to be in after surgery, because even silly things like if you drop something on the floor, you just can't bend over to pick it up. It's impossible. So with that in mind, I would heartily recommend that you buy one of those like grabber things so that you can pick stuff up off the floor. That was my number one recommendation, by the way, for a BBL. Oh, my second recommendation is when you have the BBL cushion. So after 2 weeks, when you can finally sit down on the cushion, make sure you get one that's soft, because some of the clinics, they'll give you one that's basically like a brick and it's really uncomfortable to sit on. But you can buy separate ones. So there was one from a brand called, I think it was Booty Buddy, which is much softer and a lot more comfortable. So anyway, about the procedure. So I had fat transfer and lipo to the flank and the abdomen. And I also had implants. So they put 340 implants per side. And then I had fat transfer of, I think it was 1,000 cc per side of fat. But when you first have the procedure done, you know, the area looks really swollen. You don't know exactly how much fat that is going to take there. So it does shrink down quite a lot over the subsequent 3 months. After you have liposuction done, the area feels really numb, and it's really strange because the skin feels sort of loose against the underlying muscle, and it just takes a little bit of time for it to sort of stick back down again afterwards. But I regained full sensation after. I did get a complication though. So I don't know if you guys have ever heard of a seroma before, which is where you basically get a collection of lymphatic fluid underneath the skin where a false pocket has been created. Interestingly, I got a seroma the first time I had liposuction as well, but a smaller one because the liposuction was less all-encompassing. So I think, you know, maybe I'm just prone to them. So in my case this time, I got a seroma around the pocket where one of the implants was put in. So they do the incision for the implant just above your butthole in your butt crack, and you have one per side. And that's how they tuck the implant in between the muscles there. And so on one side, there was a big collection of fluid, which I didn't know about. And I'd actually gone to the clinic after 2 weeks to go and have my sutures removed. And then when I came back, it just burst open and all this seroma fluid came out, and it was very dramatic. Thankfully, I knew that I wasn't going to die immediately because it was just like a clear fluid, not with blood. So I figured, you know, it was just lymphatic fluid, which is what it was. Guys, if you get a seroma like that, there's not really a huge amount that you can do about it. You just have to wait for the drainage to stop. So mine took quite a long time to slow down. It took maybe around 3 months in total. As I'm filming this now, the hole where the seroma fluid was coming out is still there, like a little bit. It's less than a centimetre now, but it's closing now by secondary intention. So Dr Aslani has said that in 6 to 12 months, to go back, and if I want to do a revision of the scar just under a local anaesthetic, then I can do, which is good, fair enough. So I got a seroma also here on the waist, even though I was being really good and wearing my compression like all the time, just like he likes you to wear it. So he likes you to wear this like full body faja for 6 weeks with 2 like Velcro waist bands over the top of it. And then you just wear it at night for a further 6 weeks afterwards. But even now, and I'm more than 3 months post-op, I'm still wearing it at night just to see if I can compress that seroma a little bit. In a way, it kind of doesn't matter because I want to go back anyway just to do a few little touches up. So when I go back, I might do a second round, I don't know, which is crazy, right? Because I thought when I had the procedure done, I was like, oh my God, I can't believe that some women do this 4 times. They must be absolutely insane. And now I'm actually one of those people that's thinking that I want to do it again. I guess this is what it's like. I don't have kids, but I guess this is what it's like when you have children and you think, oh, that's it. I'm never going through that again. And then you do. Interestingly, there was no pain at all after the procedure, like just none at all. But the surgeon said that you either in the camp normally of having no pain or tons of pain. So most people have absolutely no pain, but a very small number of people have tons of pain afterwards. So I'm really glad that wasn't me. So you're probably wondering, why did I bother to go all the way over to Spain to have the procedure done? Okay, well, the reason is I live in the UK, and for a long time, BBL was actually not allowed because of the high death rate of women and men globally who were having the procedure. I think it was like 1 in 3,000. And that's because of the way that the procedure was done. So if you take the fat and you basically inject it in between the muscles, there's a big blood vessel that goes up to the lung in between the muscles of your butt. And if the fat is injected into there, then you get a fat embolism and you can't breathe and you basically die. Obviously, that's not great. So this particular surgeon has a technique where he will place the fat superficially, so under the skin, but in order to get the projection, he'll also place an implant as well. So when you put fat in, it's hard to get lateral projection. With an implant, it's much easier because, you know, it's a solid thing, so you can get that lateral projection. And then he puts the fat over the top just to kind of give it a much softer and rounder appearance. So he's got this dual technique, which he's actually published on. And this particular surgeon does a ton of these procedures every day. So when we chatted, he said he was doing like 5 or 6 of these a day. So if you're going to have a procedure done, whether it's breast augmentation or a rhinoplasty or a facelift or whatever, in my opinion, you should go to a surgeon who just does that one specific procedure and they've got a really high case number. You don't really want to be going to somebody who maybe just does it once or twice a month, because your result is never going to be as good. And if you have a complication, they may not have seen that particular complication before. So in my case with the seroma, apparently with implants, there's a complication rate of maybe 1 in 50 people will get a seroma. It doesn't necessarily mean it's going to come out from the incision site like mine did, but it's not an uncommon thing. And the complication rate is higher with implants than it is just with the traditional BBL where you just put the fat in. However, I have to stress that I do not at all regret putting the implants. I'm actually thrilled that I put the implants, because then you've got the predictability of having something which you know isn't going to atrophy, whereas the fat is a lot more unpredictable. And I must be thrilled if I'm considering going back to have it done again. So I'm actually going to film another video with Dr. Aslani in an interview format with him, so you can learn a bit more about how the procedure's done and what his specific recommendations are for pre and post care. So how do I feel after the procedure? I gotta tell you, it has literally changed my wardrobe. Like beforehand, I would never feel comfortable enough to wear, I don't know, say high-waisted jeans or like a little crop top. That was totally out of my remit. Probably should be out of my remit to wear a crop top because I'm 40 next year, so that's probably correct. However, I'm still doing it. So I'm really looking forward to going back and getting my seroma sorted out and also having my scar revision as well. But I think that's probably going to be maybe in like 3 or 4 months because I can't do the revision anyway until 3 months post-procedure. So of course I will keep you updated with how it goes, take you along there with me. I'm going to be having that interview with Dr. Aslani really soon. So if there are any questions that you want me to ask him about BBL specifically, let me know in the comment section below and I will ask him when we do the interview. Okay guys, so that's it for this week. I hope you enjoyed the video. I'll see you again next week where we'll be talking about something completely different. Don't forget to subscribe. See you later.